Hello, how you guys doing? Have y'all been waiting for me? It is a little past 4:30, and I apologize for that. But I'm here now, and I'm really excited about today's topic for our Go Live. So for those of you guys who are tuning in late, make sure you go ahead and share today's topic. And for those of you who are replay viewers, thank you so much for coming to the Dr. Terri MD page to join us for today's topic. So as you guys recall, today's topic is going to be on the common problems that we see in the ICU nursery for preterm babies as well as term babies. So I like to call it NICU 101, but it's not just for preemies. Remember, it's going to be for term babies too. So just to refresh, this is NICU Awareness Week. Yay! And this is day 2 of our NICU Awareness series on the Dr. Terri MD page. So yesterday we talked about newborn screening. I really appreciate the feedback that we got on that, and several of you found that helpful, so that really means a lot. And today we're going to talk about common problems that we see in the ICU nursery. So you guys know who I am. I'm Dr. Terri, MD. I'm your board certified neonatologist and pediatrician, and I specialize in the care of sick preterm infants as well as term infants. My mission is to train providers how to help families navigate difficult conversations so that they can make the really tough choices. And really my goal is that every family in the ICU nursery would know that even in the midst of despair or even in the midst of a scary situation, they can still have hope. So that's my goal, is really to train providers to help families receive the gift of hope. And so I hope that you guys are able to receive that through these various videos. So before we get started for the common problems that we see for preterm babies as well as term babies, I wanted to just share a little bit about why I even wanted to be an ICU nursery doctor. So many of you guys already know my story, and Facebook even reminded me of my story today. But I just thought it would be cool just to share my story again, since today we're really talking about the babies that I see every day that I consider it a privilege to see. So my sister was born premature in 1968. She was born 4 months early. She was born in July, and she was, 3.5 months early. She was born in July, and she was due at the end of October. And so she was born only a couple of years after President Kennedy's son, and President Kennedy lost his son to prematurity. And so that was right when we were developing NICU. So I'm always fascinated by the fact that my sister A is here, and that we have so much more technology now than we had then, and that my sister was normal. And so to take care of a baby that could fit in the palm of your hand, to take care of a baby that would be in a plastic box, those are the things that motivated me as a child. I really wanted to be the kind of doctor that took care of the babies that could fit in your hand or in the plastic boxes. So that is why I decided to pursue a career in neonatology. So we talked about yesterday that the NICU is the neonatal intensive care unit, and we primarily take care of premature babies there. But not just premature babies, we also take care of term babies. So for those of you who are having a premature baby, or who had a premature baby, or who may be having a premature baby, or even if you know someone who's worried about preterm labor or they're on bed rest because they may have a preterm baby, these are some of the common things that we talk to families about who may be having a premature baby. So the way I usually approach that conversation with families is I just go from head to toe, okay? Head to toe. So the first thing is the head. Premature babies, because their brain is not fully developed, do have a risk for having some bleeding in the brain as a result of stress. And so they can have some problems with brain development, or if it's significant enough, they can have some problems with cerebral palsy later. So that's the first problem that we can see for premature babies, is that their development can be affected. So the more premature they are, the more we will worry about that problem. If it's a bigger preemie, we're not as worried about that problem, but certainly for the micro preemies that are just a pound, or for the babies that are 22 to 26 weeks, we do worry about that problem of affecting the brain. Next, I talked to the families about the eyes. So we did brain, and now for eyes. Eyes. premature babies, when they're born, their eyes are not fully developed. In fact, the human baby, if you're born less than 24 weeks, the eye is still fused when they're born, okay? The eyes actually haven't opened up yet. So they open up somewhere between 23 to 26 weeks. And so if you have a baby that's 22 to 23 weeks, the eyes are even maybe still fused because the baby's so immature. But premature babies, because their eyes are immature, have an increased risk for developing something called ROP, retinopathy of prematurity, and that is just a fancy name to talk about the way the blood vessels grow from the back of the eye to the front of the eye. And because of the way they grow, and because of the baby being exposed to stress, one stressor is needing a lot of oxygen, these blood vessels can grow abnormally. They often can grow on top of each other. And if they have enough problems with their eye development, hi, I see you out there, thank you for joining us, then they can have problems with their eyes, significant problems. They can even have blindness or detachment of the retina. So we've gotten much better at monitoring the eyes for premature babies. They all get eye exams, the ones that meet the criteria for that, the babies that are less than 32 weeks and 1,500 grams. And if we see concerns with the eye, if the eye doctor sees that, then they can have laser surgery for that. And we've gotten a lot better with monitoring our oxygen levels, okay? So the first problem we can see in preemies is the head worrying about the brain. The second issue we can see with preemies is the eyes worrying about the eye development, okay? So brain, eyes, and then I like to go to lungs, okay? So that's the biggest thing most of us are worried about in the delivery room. The parents, your providers, your respiratory therapists, are we going to be able to breathe for the baby, right? So we may be worried about the eyes later. We may be worried about the brain later. And we do talk to families about that. But if we cannot breathe for your baby, if we can't get enough oxygen into the lungs to move the chest and keep the heart beating, then we're going to not be able to save the baby. So really, the breath of life is one of the most significant things that we're concerned about in the delivery room, the breathing and the heart rate. But we do talk to you about those other problems because we know that most families aren't just concerned about is the baby going to live, they're concerned about is the baby going to have a good quality of life. And so depending on how premature the baby is, they will need more support, or depending on how sick the baby is, or if there are other associated factors like infection. The smaller the baby is, or the sicker the baby is, they may need more oxygen. They have to be on the breathing machine longer. They can have some scar tissue from being on the breathing machine. They often, if we can't get them off the breathing machine, they may require a tracheostomy in the really tiny babies. But most of them we are able to get off the breathing machine, but some of the babies do require a tracheostomy to actually get off the breathing machine for the really small babies, okay? So brain development, eyes, like retinopathy of prematurity, lungs, we talked about lungs, okay? So that's 3 things you guys already know with respect to common things that we can see in the NICU that we talk to families about. 4, I always like to mention the tummy. The tummy is really important, right? Because while the baby's inside mommy, the baby is not eating, okay? The stomach is developing because the baby's swallowing stuff like old skin cells and, amniotic fluid, and that helps the stomach to develop. But once the baby's born, we have to put food in there to help the baby to develop. And one such food is breast milk. So we really try to encourage all of our mommies to pump breast milk and to provide breast milk to babies. I personally, and many of my colleagues, we don't consider breast milk to be food, but really medicine. Medicine is a therapy that has been shown to improve outcomes for premature babies and especially decrease their risk for infection, which is one of the reasons why many of them do not survive. And they can get a very serious stomach infection called NEC, or necrotizing enterocolitis, long fancy name. But what it really means is that the baby has a severe infection where the bacteria is eating through the lining of the stomach. And the way we usually see that in the nursery is the baby can have blood in their stool, the baby may not tolerate their food, the baby can have a low blood pressure, low oxygen, stop breathing. Okay, so we always talk to families about this stomach issue because really you could have no problems with the breathing, you could have no problems with your eyes, you could have no problems with your brain, and then suddenly end up with this very severe infection called NEC. So that's number 4. Okay, so the brain is one issue. The The eyes is one issue. The tummy is one issue. So we talked about brain, we talked about eyes, we talked about tummy, and we talked about lungs. So you guys already know 4 of the most common things that we can see in premature babies. The next thing is, oh, I'm sorry, I'm getting comments. Thank you guys for joining us. Thank you guys for joining us. The next common problem that we can see in premature babies is issues with the heart. So many premature babies can have a heart murmur. Sometimes that's very frightening to families, but really we all have tiny holes in our heart when we're born that are supposed to be there. They're part of our normal development. They eventually close on their own. And we all have this extra blood vessel there as well that serves a vital function when the baby's inside mom in the womb that goes away on its own as well. It's called a PDA. So many of you guys who have had premature babies may have had the doctor talk to you about this PDA that many babies can have that doesn't necessarily cause problems for the baby. But for some premature babies, it can cause problems, okay? For some premature babies, it can. So for those babies who the PDA is not going away, for those babies who we feel the PDA is causing more problems with the lung, the PDA is preventing the baby from getting off the respirator, the PDA is affecting the baby's growth. For those babies, they may need to require medicine for that or even surgery, okay? So those are some of the big 5 things that we talk to most parents about for preemies. And like I said, we could go from head to toe. So brain, we talked about development and the risk for bleeding there or some issues with development there. We talked about the eyes and talked about issues with scar tissue there and a risk for blindness. We talked about the lungs, making sure that we can breathe for the baby, get enough oxygen in there, and hopefully when the baby gets big enough, we can get the baby off the respirator. But for some babies, there can be complications. And we talked about the stomach, right, and the importance of breast milk and this really severe infection that premature babies can get. And we talked about the heart, right? That extra blood vessel or sometimes these tiny holes in the heart that some babies can have. Most babies will have. And for most babies, it goes away. But for some babies, there can be problems. Thank you guys for joining. Thank you for joining. I appreciate you. And so for number 6 for preemies, I would just like to say blood. So usually when I'm finished going from head to toe with the family, and I've mentioned brain, eyes, heart, lungs, tummy, I like to mention blood, okay, because there are 2 issues with the blood. Premature babies have a bigger risk for jaundice because they're not eating as much, right? So they're not eating as much, so they're not pooping as much, so they have a risk for jaundice, but also they can have blood infections. So we talked about stomach infections, but a big risk for premature babies is blood infections, and many of the babies who don't survive, in fact, it's because they have a blood infection that we can't treat. So can you guys name those top 6 things that we just talked about for preemies? You guys just got the NICU 101 for preemies. We talked about the head, right? There can be issues with the brain development. We talked about the eyes. There can be issues with the eye development, and we watch your oxygen levels closely for that. We talked about the lungs. The lungs, depending on how immature they are, they require more support, and they can have some complications. We talked about the tummy and how important breast milk is to prevent an infection. Talked about the heart, how babies can have something called a PDA, this extra blood vessel that we all have that usually goes away, especially in term babies, but sometimes it stays around and likes to cause a few problems. And then we talked about the blood, right? Because sometimes you can have issues with jaundice as well as infection. So obviously, there are many more things that we look at in the NICU, but I just wanted to kind of go over the big picture of some of the things that we're talking to families about when they're first admitted with respect to a stay in the ICU nursery. So those were your premature babies, right? Small babies, the micro preemies, the ones who are going to be there a while or until closer to their due date. So what about the term babies, okay? We have quite a few term babies that have to come to the NICU or almost term. So we have 36-weekers, 37-weekers, 38-weekers, you know, only 2 to 4 weeks early who may have to come to the NICU. And that's very frustrating for families. You know, you got a big baby, you got a 7, 8, 9, 10-pound baby. Like, why do you have to be in the ICU nursery? So if you have a 1-pound baby, you kind of understand, okay, I need to be in the ICU nursery. But it's really hard when you have a 7 or 8-pound baby and, you know, you have to leave. It's hard anyway to leave the hospital without your baby for all those families. But sometimes for our parents of term babies, it can be difficult to kind of explain the rationale for keeping the baby in the ICU nursery. I can assure you that we all want your baby to be able to go home as soon as they're ready. Like, we want your baby to go home even more than you want your baby to go home. So we take that very seriously when we decide to admit your baby to the ICU nursery. So for term babies, what are the big three things that we can possibly see for term babies in the ICU nursery? Okay, so the first reason that many term babies come to the ICU nursery is something called transitional breathing. Okay, so that's a baby who had a relatively okay delivery. It may have taken them a little while to get out. They may have gotten a little stuck. They may have swallowed a little fluid. They may have had the umbilical cord around their neck. But eventually they start crying and they look like they were doing okay, but then they start breathing a little fast, okay? And if you breathe fast enough, you're not able to eat. And sometimes they may need oxygen. So for those babies, we will monitor them in the ICU nursery, and we call that TTN, or transitional tachypnea of the newborn. Fancy name. I just call it transitional breathing. So I usually explain to families that all babies have to go through transitional breathing. Some babies do it faster than others. Some babies take a couple of hours. Some babies take 12 hours. Some take 24. But they should go through that process really within a 24-hour period. If we find they're still breathing, you know, at 48 hours, 72 hours, you know, we start worrying that, you know, is something else going on? Does the baby have an infection? Does the baby have pneumonia? Is there something else going on with the lungs? Do we need another x-ray? Things like that. So, but if they're just breathing fast, and everything else looks okay, we can monitor them with the expectation that hopefully they'll get better. So that's a really, really common reason why a lot of babies come to the ICU nursery. Another reason is mom had a fever, and there's a concern that the baby may be sick, okay? There's a concern that mom may have had an infection called chorioamnitis, which means that the baby can also possibly have this infection, especially if her water was broken for a while. She has a fever, the baby has a fever, or if the baby has any other symptoms with that history. We may watch the baby in the ICU nursery. We may do some antibiotics just to see. At some hospitals, the baby can stay in the room with the mom, and we do the antibiotics and watch the baby. It just depends on the system, but that's another reason why we may have to watch a term baby. And then number 3, jaundice. So jaundice is a really common reason that babies come to the ICU nursery. If you guys remember from our other live stream, jaundice is common. All babies have jaundice. They're supposed to have jaundice. You may not be able to see it, but it takes a while for the liver to process the food, pass through the system, and convert it so that babies are able to get enough hydration. Okay, so most babies do that between 2 and 4 days. Certainly by a week, they should have flushed that system through. But at 48 to 72 hours, some babies, the jaundice number is just too high. They may not be eating enough. They may not be pooping enough, and so they may need to come to the ICU nursery to be treated for that. Sometimes they can stay in the mom's room and be treated, but often, depending on the number, we will watch them in the ICU nursery. Okay? And then the last reason that a term baby may come to the ICU nursery is there's an unexpected problem that presents after delivery. So we thought everything was fine, but in watching the baby, we're noticing some things that we need to look at more closely. The baby may have a heart problem. The baby may have a genetic problem. We may need to do some blood work to look at that. The baby may have low sugars. The baby may not be eating well. The baby may have a seizure. And so unexpected problems, okay? So just to review, for our term babies, lungs, transitional breathing. Number 2, we talked about, in addition to transitional breathing, we talked about infection. You know, mom may have an infection, so we have to check the baby for that. Number 3, we talked about jaundice. The baby may have some jaundice, and we may need to treat for that. And then number 4, an unexpected problem that didn't show up till later. Okay? So those are the most common reasons that we may see term babies in the ICU nursery. We hate to take your babies away from you, as well as premature babies. And we hate to take your babies away from you too. And so parents, in my opinion, are part of the team. I think it's really important that parents know, okay, these are the things that I'm worried about. These are the things that we're going to focus on trying to treat. This is our plan. And when these goals are met, we can talk about when the baby can go home or when the baby might want to leave. And that's actually our live stream tomorrow is what are the most common questions from NICU parents. And the number one question is, when can we get out of here? Okay. So that is wraps up our information for today on the common problems in the ICU nursery. I hope you guys found that helpful. Please go ahead and share with your friends if you did find it helpful. And to our replay viewers, thank you so much for joining us. I'm Dr. Terri, MD, and I'm your board-certified neonatologist and pediatrician. I specialize in training providers how to help families navigate difficult conversations so that they can make informed choices and at the end of the day receive the gift of hope. And so I do that through my speaking, my courses, my webinars, and my books. And I really appreciate you guys joining me today as part of NICU Awareness Week. So tomorrow we're going to talk about the most common questions we get from NICU parents. And if you guys have some questions that I don't have, go ahead and post those so that we can share those questions as well. Okay? You guys be well, and we'll see you tomorrow at 4:30 on the Dr. Terri MD page. Okay? Thank you guys. Bye-bye.